There are a lot of underlying conditions that may predispose certain people to develop severe COVID-19 infection and be at a higher risk of hospitalization and death. These include having underlying health conditions like obesity or diabetes, being male, and being over 65 years old. Let's visualize some of these risk factors in COVID-19. 42% of US adults have obesity. While there is not yet data from the US on the proportion of COVID-19 related deaths where the patient had obesity, one study from New York City found that among the under 60 population, patients with a BMI between 30 and 34 were 2 and 1.8 times more likely to need acute and critical care, and patients with a BMI above 35 were 2.2 and 3.6 times more likely to need acute and critical care, compared to patients with a BMI below 30 and under 60 years old. Visualizing on the dashboard in North Carolina, we can compare the death rate on the left with obesity on the right. Over 10% of the US population has type 2 diabetes. We only have data on underlying conditions for 22% of people diagnosed with COVID-19 in the US, but of those with underlying conditions, 30% have type 2 diabetes. In New Mexico, we can compare the case rate on the left with diabetes on the right. In Arizona, compare the death rate on the left with diabetes on the right. And in South Carolina, we can compare the death rate on the left with diabetes on the right. There are roughly the same number of males and females in the United States, with just slightly more females than males. However, among all COVID-19 deaths, 20% more males than females have died. More males are also hospitalized and admitted to the ICU for COVID-19, far more frequently than females. These numbers may not even reflect the higher prevalence of COVID-19 complications in men than women, because older people are also more likely to deal with death and hospitalizations, and men have lower life expectancies than women. In West Virginia, we can compare the case rate on the left with the percentage of residents who are male on the right. In the United States, 15% of the population is over age 65, but 80% of COVID-19 deaths have been in people over age 65. In Mississippi, we can visualize the death rate on the left compared to the percentage of residents over 65 years old on the right. Take a look for yourself at these maps and see the relationships you can visualize between COVID-19 and county characteristics.